Hey guys, Kim here, and you are tuned in to Kim E, the Diabetes MP, a place where nurse practitioners can improve their diabetes education and management skills. Now, this is February when I am filming this. It is Black History Month, and it is also Heart Awareness Month. And so I felt like it could only be right. It is only right if I merge the two. So today we are going to talk about the African American diabetic in regards to heart disease. Now, a couple of weeks ago, I had the opportunity to sit down with one of our nurse practitioner colleagues, Devyn Nixon, and her handle on Instagram is D the NP, but she works with congestive heart failure patients and works with just heart disease patients that struggle with all kinds of heart issues. And it was a great Instagram live, and if you're interested in seeing that full video, I'll link it in the description box. But some of the things that we talked about in that interview, I'm going to discuss today with a little bit of other things sprinkled in. So if you are wanting to learn more about the African American diabetic and heart disease, stay tuned. We're going to get into it. So let's talk a little general overview, a little background when it comes to diabetes and heart disease. Now, diabetics in general are 2 to 3 times more likely to develop cardiovascular issues, MIs, okay, stroke, even just sudden death. They are more likely to develop this over the person who doesn't have diabetes. Now, some of these heart issues, cardiovascular issues that people can develop can be your coronary artery diseases such as angina, congestive heart failure, even MI like I had mentioned, or can be strokes, TIAs. Also can be peripheral artery disease where you'll have the ischemia in the lower extremities. So these are things that the diabetic can develop and are at higher risk for than the person who is not a diabetic. Now, there are some classic risk factors that should be aggressively addressed in type 1 and type 2 diabetics. Things like dyslipidemia, smoking, hypertension. These things should be aggressively addressed and treated to prevent a person from developing cardiovascular disease. Now, race is a non-modifiable risk, meaning that this is something that cannot be modified. This is something that a person can't help that they have, such as well as age, gender. These are not things that a person can change that puts them at risk. And being that we are talking about the African American diabetic, being African American does put a person more at risk to develop these cardiovascular diseases. They have a higher incidence of this as well as PAD. So what is our solution when we're dealing with the African American diabetic in regards to heart disease? Well, we need to focus on our modifiable risk, okay? Now, there is something that I heard. I was listening to a podcast, and I'll link that episode in the description box, but an endocrinologist was talking in regards to diabetes and heart disease, and he came up with a very good acronym that I really loved, and it's called the ABCs of diabetes. So your A is A1C. Focus on lowering that A1C. B is for blood pressure. So that means really making sure that we're dealing with any hypertension, as I have mentioned earlier, and making sure that that blood pressure is under control. And C, some of you all may have guessed it, is cholesterol. Okay, lipid management, making sure that our patients are, their cholesterol is under control, because all of these things are linked to developing cardiovascular disease in anyone, but more specifically, very high incidence in those who have diabetes. Now, some other things to also keep in mind, the things that would definitely affect those ABCs is your lifestyle. Now, I did a whole video over lifestyle modifications. I'll link that video in the description box as well if you need to reference that. I also as well did an interview with an endocrinologist that her main focus is diabetes reversal. And her main focus in doing that is lifestyle and the way that you eat. And so I'll link those videos down in the description box so you can go back and view those after this video. But also keeping in mind tobacco use. Getting our patients to minimize how much they smoke and just to stop it altogether, honestly. And then, of course, it's been recommended for some years to start our patients on a low dose of aspirin when it's appropriate. Now, one last thing that I want to mention before I log off is that I remember when I was going through nursing school and just in general working as a nurse at the bedside, you know, for so many years, the focus has been on just the glucose. Just get the glucose down, any means necessary. And a lot of times people grabbed for medications. And I, by no means, am against medications. I've done a plethora of videos over medications in the different drug classes, but the focus we now know that the better focus is not just on lowering the glucose and not just being focused on that, but the patient as a whole. Looking at your lifestyle, looking at how much you're active, how you eat, if you smoke or not, and getting all of these different things under control. Now, something that we as providers need to do for our patients is connect the dots for them. We have to help them to understand that diabetes is not just this isolated disease, chronic disease, that it is very much overlapping with our hypertension, with our dyslipidemia, and that if we can get all of these things under control by doing things such as lifestyle modifications, taking your medications as prescribed, having your regular checkups, then I truly, truly believe, and research has shown us that this is how we're going to get better results. Okay, guys, I hope that this was beneficial to you. It was helpful. I like to just come on and just do these quick videos just to kind of refresh some people's memories and also just to even give some new information that you might not have known about. Again, check the description box because I mentioned a lot of different resources and different videos that I'm going to link for you all to view once this video is over with. You have been sitting here with Kim, the Diabetes NP, and I'll catch you on the next one. Bye.